Good afternoon and good evening, everybody. Welcome to the MeHeLP webinar session on mental health, promoting mental health literacy through recovery narratives, part 3. Great to have you on board and welcome each and every one of you through our Zoom webinar sessions and also from our Facebook page. We will normally have the discussions for about 40 minutes or so, and then we will seek questions from the audience. And then we will have an interactive question and answer session and also further discussion. We have two great guests who actually agreed to be on our webinar, Pooja Priyamvada and Smriti Joshi. I will introduce them both in a minute. Let me just talk more about the Mental Health Literacy Project in India. Mental Health Literacy Project in India, or MeHeLP India in short, is a UK Research Council funded project on improving mental health literacy in urban and rural communities. The project actually focuses in Kerala. The reason for focusing on Kerala is the human health index, the high human health index of Keralites, but at the same time, a very high prevalence of mental illness and suicide rates in Kerala. That is the reason why we have actually focused on Kerala as a state for the study. But the implications and the applications and the further impact of the mental health literacy project in India applies to all other states and all other places in India. And that's why we have been having this pan-India conversation on promoting mental health literacy in India. So what is mental health literacy? Mental health literacy is not just mental health awareness. Most people actually think that it is actually just about mental health awareness. Mental health literacy actually consists of 6 or 7 different aspects of how we actually understand it. First and foremost is actually about our ability to recognize the various symptoms and conditions of distress or disorder that one may actually experience or what others may also actually experience. And secondly, this is actually about understanding the knowledge and causes of those distress, what actually causes those distress, or what are the reasons for those conditions. It is actually having a good, sound knowledge about those. And thirdly, it's about knowledge about self-help and self-awareness, and what are the kind of ways in which we can actually understand those things ourselves, and what are the kind of ways that we can promote mental health and well-being for ourselves through a range of complementary and other approaches, including yoga, meditation, creative arts, and a number of other approaches as well. And fourthly, this is actually about how do we actually, what kind of professionals are involved in this context, and how can we actually access a psychiatrist or a psychologist or other professionals who might be involved in this field. And fifthly, this is actually about attitudes which facilitate and promote better understanding and recognition of mental illness and mental distress. But with that, I mean the stigma around mental illness. I think it's how we understand the stigma around mental illness, which is actually pretty huge in the Indian context. It is also true in other Western countries as well, but maybe not to that element as is as prevalent in India and many other countries. So it is more about understanding those things. And sixthly, this is actually about finding the right kind of information about how we can actually help ourselves and also how we can help others or signpost others to actually seek help with professionals. So it is actually important to actually have the right kind of information, because there's a lot of unwanted information that is actually floating about in different sources and different media. This is actually finding the right kind of information. And seventh element that I would actually add is the kind of cultural context of the whole thing, because I think it's important to see mental health and well-being within the cultural context of the person living in. Because if you discount the culture, you might actually fail to understand the meaning and the purpose and a lot of other aspects surrounding the individual. So cultural context and how people culturally construct mental health literacy is actually very important. So that is the context that we are actually coming from. So the 7 different pillars of mental health literacy. So the idea is that we have a conversation surrounding that, and we do that through storytelling and further introspection and interrogation of those stories for the benefit of the larger public and common people, so that we have the ability to talk openly about it. We have fearless conversations around mental health and well-being, and also about mental distress. So now I have great pleasure to introduce our guest today. First of all, let me introduce Pooja Priyamvada. Great to have you on board. Thank you for accepting our invitation to be part of this webinar. Pooja Priyamvada is an author, a columnist, a professional translator, an online content and social media consultant. She is also an awarded bilingual blogger, formerly also a radio announcer and a lecturer. She's trained in psychological, mental health first aider, emotional wellness and corporate trainer, mindfulness and grief facilitator, and reflective listener, mental health researcher, and suicide prevention and awareness activist. She has been associated and published at reputed national and global portals. Both her blogs have been awarded several times consecutively at the Orange Flower Awards. She has an MPhil in English from Punjab University and speaks vociferously about issues of gender, identity, and marginalization at several international platforms and mediums. She has been teaching disability competencies using poetry to medical students in UCMS in Delhi, and imparting mental health awareness and emotional wellness talks, webinars, and programs. She was part of the organizing the team of Critia International Poetry Festival in 2021. She has been featured amongst the 10 Indian women bloggers you must follow. That's why I'm following her, and 25 writers whose work readers enjoying the most. At Women's Web in 2018, and also in Most Empowering Moments by Indian Women by the SheThePeopleTV. Pooja's areas of work are mental health, disability activism, sexual wellness, gender and marginalization, and her favorite mediums remain poetry and theater. It's a common interest there. A single parent and a fibromyalgia survivor, she believes that she derives her strength from being a voracious reader and a tea connoisseur. So that's good. Welcome, Pooja, to the program. So let me now introduce Smithi Joshi. She is a licensed psychologist and one of the first telemedicine, tele-mental health practitioners in India. She has rich experience of 20 years in the field of mental health. She is a graduate member of the British Psychological Society and an international affiliate of the American Psychological Association. She is also a lifetime member of the International Society of Mental Health Online and Telemedicine Society of India. At present, Smriti is actually working as a lead psychologist at Wysa, contributing to designing psychotherapeutic interventions for the world's first mental health chatbot and leading the text-based coaching and training team at Wysa. Welcome, Smriti, to the program. Thank you both for inviting our invitation to be part of the MeHeLP webinar conversations around mainstreaming mental health. So the process is that we're having a storytelling sessions here. So obviously, I would ask Pooja to tell her story and her experience in terms of the mental health recovery narratives, and then I'll come to Smriti in terms of exploring her perspectives on things and in relation to help seeking and other things. And then we will enter into kind of a discussion mode on various aspects and then go into the question. So let's start. Pooja, over to you.
Thank you so much, Dr. Raghu, for inviting me. But not so much thank you for reading the entire introduction again. And thank you, MeHeLP, for doing what you do. You are involved in two of my passions, which is theater and mental health. So that forges the connect for me here. My journey with mental health has been very long. And when I say that, it is, a realization that came to me much later in life, that I was journeying with this partner without even realizing that there is this invisible partner with me. So I don't call it a recovery journey, so to say, because I don't see it in a recovery model per se. I see it as an evolutionary journey. I see it as a relationship. which has grown with me, which has grown with my literacy, my awareness about mental health, which has grown with interactions with people like Smriti and you and other peers from all the amazing work they're doing, both in theatre as well as mental health, and where they're able to connect both. For instance, when I was doing disability etiquette at medical college here, so though I was the poetry facilitator, but they do use theatre of the oppressed. So understanding how, the theatre and medical humanities was the way forward, and why the healthcare system needs to look at the world and the conditions and the people with a very different lens than it has been now for various centuries. So yeah, so let's begin where it began for me. I had not planned like a story or a narrative, but let's see if I can make a story out of it. And I guess being a parent, I might be able to do this because I've done that practice with the kid storytelling and all of that. So I guess my first brush with depression personally was when I was in my teenage, and it was my board exams, class 10th, and I went through a long period of hospitalization, and there was a major surgery. But in spite of having a parent who was very aware about everything else, and we had open conversations about everything. With my father, it was him with whom I had my first conversation about periods. It was him when I was bedridden, who from somewhere outside of Shimla, he got me tampons to ensure that, in that supine position, I'm comfortable during my periods. So we could have all those conversations. But even he could not make sense of why a 14-year-old who is doing well in life otherwise, I was the school head girl, and I had all the boxes checked of what is considered to be a happy child in India. And then why doesn't she feel happy? What is bothering her? So he could not make sense of it. And in a small place like Shimla back then in early 90s, going to a psychologist or going to a counselor was not heard of. Our schools did not have counselors. So nobody could even imagine that a teenager could be going through some kind of distress or anxiety or whatever. And it was actually 10 years later that when I revisited the entire process, that I could pinpoint that these were the crisis situations, or this was the journey. Now, 10 years later, again, though I had done a lot of my education, travel, awareness, and all of that, and yet it took me, birthing a child and going through the entire pregnancy and delivery and all of that. And then when postpartum depression hit, that is when, luckily, I was in Delhi. And in Delhi, by that time, it was not such a big taboo that it was in my smaller town earlier. And I had the economic independence to and the you could say the emotional and the intellectual independence to say, okay, this is it, I need to speak to a therapist. So that is when I went to a therapist, and that is when there was a label to it, so to say. Or the way it helped, the label helped, was that I could read about it, that I could research about it. I was already a researcher. I was already writing, but then this became like a passion. I want to read about it. I want to know what happens and why we behave in certain ways, and why we have what the clinical world calls disorders or conditions or whatever. And that is where I also started learning and getting myself trained in whatever way I could help myself or help somebody else who was in any kind of mental health distress. So sadly, in India, again, at that time, there was nothing much happening. There was no sort of peer support groups. There were zero awareness in families and workplaces. In terms of even self-care, there was nothing. There was nobody who would tell you that this is what you can do if you're living with persistent depression or whatever. I mean, I don't want to use the clinical labels now, but yeah, I mean, there was nothing really. And yes, even back then, going to a mental health practitioner was a privilege. It was expensive. It took time. I had to take time off from work. I was looking after a young baby, so it was not so easy. And yet I could do it was a privilege because I had the economic privilege or the class privilege or whatever. But I know that thousands of women and other people also do not have that privilege even now, even a decade and a half later in India. So that is how it started from me. And then I started writing in India. I was already writing on my blogs and my 2 blogs and then other websites. And then I got connected to other platforms globally. And that is how my research went. And then the columns started. So then I had to research for columns. And then I made friends in community and, practitioners, survivors, people who were planning to start peer support groups back then. And that is how, my journey has reached where it is now. And because my core skill was language, and I was doing theater, and theater was one thing I was good at, and poetry was another thing that I think I'm good at. So I could integrate those two into, my activism or whatever I was doing regarding mental health. And because I happen to be a translator, so it occurred to me that we are still talking about mental health in India, which officially also has 28 languages and hundreds of dialects, but we were only talking in English, which was again a huge privilege, and which was again then depriving a large audience or a large section of people from whatever little information or support was already there. And that is when then I started writing about mental health in Hindi. And I started encouraging people in my translation communities to translate whatever they had into other languages, into their languages. And whenever I would do a webinar in a smaller place like my hometown or somewhere else, so I would try to do it in the language, in the regional language. So if I can speak Punjabi, so in Punjab, I would try to do it in Punjabi because I thought that would make more sense. Already the terminology or the understanding of mental health, so to say, or the references are all in English, largely in English. So at least the conversation needs to happen in a language that the people are comfortable with. And even today, I think that is one thing, that is one area that lacks. That is a huge gap that survivors or even practitioners like me have to fill in, have to constantly keep filling in. Now, like I'm a parent and I'm a caregiver to my elderly mother. And she's also in the beginning, stage of dementia. Though she's an educated woman, explaining it to her in English is not working, did not work. So I had to actually, bring the whole thing down to Hindi and to explain it to her in Hindi, that this is probably, what is happening and this is how we will need to manage it. Then recently I translated a book for caregivers for children with Down syndrome also. And that was the objective there as well, because when we went for these workshops, a lot of parents wanted to know, they wanted to be of more help to other parents, to their own children. But if we give them those flyers or pamphlets or whatever in English, it is of no use for them. So it has to be in their language, and also not in very clinicalized academic language, but in everyday conversational language. That is very, very important. So I think the mental health discourse for me has been also my journey with languages, has also been like you mentioned the Kritya Poetry Festival. So I was in the hosting team and I was also supposed to read my poetry there. So I told the other organizers that I would like to read 2 poems about depression. And you won't believe it that even now in 2021, people find it weird that you can write a poem about depression. Would it be a sad poem? What kind of poetry can be written about depression? So integrating all these various things is something that will then, for me, makes mental health discourse very integrative, and that integrational approach is what I am working towards, both as a survivor or when I'm a caregiver or when I'm a practitioner. I try to, bring in all these elements together, and I find an eclectic mix every time. So it is as eclectic as I am, and that is I think that has worked for me. Thank you.
Thank you very much for that story, and I think there's a lot of things in it that how you've actually traveled, taken your journey forward into different layer and different dimension that you're comfortable with, and being a mother and also caring for your mother, and also the journey of depression. And I think we'll come back to all of those things. I mean, I think rich narrative, and I think I wish there are many people who actually spoke about the conditions and about other things just like you, Pooja. So very grateful to you for coming forward and talking to us about that. So thank you very much. I'll come back to you about a few discussion points in relation to that. Now, over to you, Smriti Joshi, in relation to exploring your story. I know you're not telling a story about other things, but you're telling a story about your work. But I know that, yeah, over to you.
Pooja, thanks for being so vulnerable and sharing about yourself. It's definitely not easy to speak about your challenges with the illness and how you overcome them. And kudos to you. Like Dr. Raghu said, that it'll be so amazing if more people came out and spoke and shared their journeys, because I think that's how we, in our culture specifically, we've learned through stories, and specifically stories that have been handed over from people to people and communities to communities. And just a huge thank you and shout out to you for doing this, and a big shout out to MeHeLP for organizing programs like this, which help us share our experiences, bringing people like Pooja and together here on the platform. This is amazing, and thanks Dr. Raghu for sending the invite and considering me worthy of being a part of this panel. I also did not prepare a script or anything, because I thought the more natural it is, the more honest and transparent it would be. So I decided to keep it like that. And I think what I will share is how I got into psychology, and what's kept me in here for the past 20 years, and my experiences, my own brush with an illness, a brief stint though, but I did experience something very intense and acute at one point in time. So to begin with, we had a school counselor in the school I had, and she was a very gentle, warm, compassionate woman. She's there. And she was my inspiration, because even as mothers, I'm a mother, and mothers are considered to be very compassionate, but also we have our moods and our anger outbursts. And this was one person, and I was a very I would say hyperactive child in the school, and I was in my mom's school, so there were a lot of times where I was taken right to my mom in the staff room, where everybody would be like, okay, this is this teacher's daughter who's doing all these naughty things and all these focusing on everything else but academics. And my counselor, Ms. Girija Vasan, was the only person who would not judge me and just sit with me and listen to me. And I would just look at her in awe and like, who is this person and how does she have so much of compassion? And she never gets angry at me, and she never scolds me, and she never says I'm bad, but she tells me what I can change to become better. And and I had taken social work as my SUPW, which was supplement subjects we had to take in India in our schools at that point in time. She took us to this place called the Cheshire Home, which is a home for the people with mental health disabilities as well as cerebral palsy. And that was my first exposure to any kind of disability, mental or physical. And I came back home very moved by the sight that I saw. There were kids who were deserted, families that abandoned them. They were in a very bad living condition at that point in time. Some of the girls were having their periods, but there was nothing provided to them to manage it better. The nurses and the assistants were doing their best to help them with their basic activities of daily living, but they were nothing else was considered for them to be important. That they were humans, they had their needs, they wanted to talk, play, engage, but there was nothing else except caring for their activities of daily living, which was something that really touched me. That was there no one considering that they had feelings and they had thoughts, and they were all, some of them were communicative, and even those who cannot verbally communicate had so much I could see that when we were there, they were joyous and they were clapping, and some of them were holding on to my hand and not letting me go. And there was that so much to say, and thus that non-verbal communication that happened between us and that brief stay at the Cheshire home. It was just a day visit. And then I decided that I had to be in the mental health field. I wanted to, that moved me a lot. And I was discouraged by a lot of my family members, not my immediate family members, but a lot of my family members, that don't go into this field. What will you do? You'll have a breakdown yourself. Colloquially, they would say "Paglon ki doctor banegi," irrespective, I did enter the field. I took up psychology for my 11th, 12th, then for my grad, then for my post-grad, then my MPhil. There was no break in it. But throughout the journey, there have been these experiences. Like I remember in the grad, again, we were taken to IBHAS, which is today IBHAS, but back then it was Shahadra Mental Hospital. That was the term, Shahadra Mental Hospital. Today it is Institute of Human Behavior and Allied Health Sciences, which is a very decent and name for a hospital which caters to mental health. But back then, when when I started my MPhil and people and my neighbors got to know, I would be staying there for 2 years. I have experiences where some of my cousins and family members and neighbors actually distanced themselves from me, as if I would be carrying something contagious with me that I would bring in. So, I would say, I don't know what to call it. Was it lack of awareness, or was it the wrong kind of awareness about mental health and mental illnesses? Like Pooja said, that really pushed me to take up a lot of community activities within my neighborhood, within the communities which we were serving around IBHAS, where we actually went and did a lot of discourses around the pain that people experience with mental illnesses, and how it is just as similar as pain that people experience with physical health issues, and they are very real. And I totally again agree with Pooja that the language makes so much of a difference, so much of a difference. The terminologies that people had, using the same terminologies, that how we use pagal and some other words, so without even giving it a thought in our interactions, could mean something to a person who's actually going through a illness. And and also during my experiences with during my training in the hospital, where we were doing, when we first started with getting trained in doing clinical interviewing and speaking to family members and about different kind of illnesses that people were bringing in, or different conditions people had, they had these very interesting explanations for what was happening to their loved ones or to the relatives. It ranged from being possessed to a wrong medication, or a issue with the person himself, as if a deficit was present in the person, or a lot of blame that mothers specifically had to bear with, as if everyone had some insight into Freud, but not the right kind, where mothering is given so much importance. But here it was that when the child was doing well or child is doing better, it's the family or it's the community that's contributing to it. But when the child is not doing well, or when an individual, even as an adult, is having problems, what has your mother taught you? Is this what your mother has taught you? Or the mother definitely did not take care of this child. This theme was so prevalent in so many conversations that happened during my training years. And again, it moved me a lot, because I know at that point I've seen my experience with my mother was that she's been with me, she's done her best, given me the best education, given me the best kind of support wherever I've needed it. And it felt very disturbing for just this one particular person in an individual's life to be blamed for the mental health or condition that they were bringing in, specifically people who had genetic disabilities. It was the mother who was so, blamed, as if it was only her that caused that kind of a deficit or disability in the child. And along this time, there was a period where I had to move to the US with my husband, and I was on an H-4 visa. And I couldn't work there, and work had become a part of my identity, and my conversations that I had been having with the community, with my clients, were a very important part of my life. And I suddenly felt very incomplete, and I had not known the repercussions of being on an H-4 visa. I went there very excitedly that, oh, this is the land of opportunities, and clinical psychology has so much of a scope there. And having done my MPhil, I have that degree, that license that gives me the power to go and practice, not knowing that H4 would not consider any of that. And I also had a baby there. And I think that getting into that responsibility at that point in time, when I was already going through a struggle myself, and I did not realize at all that how having my baby there, I thought it would help me be occupied and distracted, and I would be into that nurturing, mothering role, would help me feel positive. How that entire expectation that I had from that experience just did not actualize. And in fact, it really broke me down at that point in time. And it was very shocking to me because I was a psychologist, I was a mental health professional, and I was supposed to know it when it started, and I was supposed to know that I could go and seek help. Then what was it that was stopping me at that point in time? I still try and find answer to that question even now. I haven't realized it fully, but I think it was because I was in a foreign country with no family support, and there was a lot of responsibility on my husband and me, and I was probably thinking that I don't know what sharing about my mental health concerns here would mean for us, what would it lead to. And also, I think something that held me back was my own stigma, that I am someone who's supposed to identify and know, and I'm aware and I'm literate about it. And still, I think the biggest barrier was that how can I, being a mental health professional, get this? And how could I not notice it? I sought help then. I did seek therapy, and it helped me to a great extent afterwards. But I think it got delayed for a long time. And there I used the opportunity to study telemental health in detail, learn more about the field, and I changed my stream. I used the opportunity to connect with my existing clients in India. And again, I mean, this particular field, it has an immense scope of scalability and increasing accessibility to clients. But how just my own fellow professionals in the country, when I came back, received it and received my joining or shifting the field from in-person work to online virtual work was almost heartbreaking, because I was almost like the black sheep in the community, that, oh, that's not real clinical work, and that's not something which is useful. So I think with that kind of a mindset, I thought, say something like the pandemic did happen, and people had to make that forceful shift to telepsychology and offering telehealth. But like you were speaking about the attitudes of, I think, not just people who seek help, but people who provide help can act as barriers to offering that help, because that flexibility is absent, and the traditional models may be considered to be the perfect models to deliver help, not understanding that how innovation could actually help bridge the gap, if not permanently, at least temporarily, for the phase where you're unable to meet your clients. where they want to meet you, in times of need, when they are in need. So yeah, I think that's what I want to share in terms of.
Thank you very much, Smriti. I think that's enlightening in terms of your ambition to become a psychologist and your journeys along your life in relation to conversations around own mental health and well-being, and some of the how you actually communicate as a professional. Thank you very much. And I think I also had the same ambition when I was at school. I used to say that I want to be a psychologist. And that's what I did, regardless of the family persuasions for me to become a doctor. So I said, I don't want to become a doctor. I want to become a psychologist. And I think there we are. So, and that's my journey. So anyway, so thank you for those stories. So now let's get to the kind of discussion with Pooja and Smriti. So can I first of all come to Pooja in terms of this? You talked about the depression. You talked about a long time in relation to how we have traveled through that journey. What about the stigma? How did you overcome the stigma element of things in terms of, I know you had a very close relationship with father and then conversations around all those things, but what about the wider context of things? Could you tell us more about it, how you overcome that stigma and also having the boldness to actually talk about it and trying to seek help about it?
Yeah, thank you. You see, I think it stems in homes, in families, in parenting, in how children are raised. Smriti talked about mothers. Motherhood in India is very complicated. On one hand, we glorify mother is this and mother is that. On the other hand, we blame them. And there's a third aspect which is never talked about, is that a mother can be abusive. A mother can be the catalyst or the oppressor in a situation for a child. And that is never, ever even considered. A father as a caregiver, again, is not even ever considered, even now. That a father can have a caregiving role, can be compassionate, it is still not seen. I was lucky to have a father with whom I had no shame and no fear about anything and everything. So I think it started from there. When I could speak to my father about my periods, or about my first boyfriend, or about my first sexual experience, or about contraception, then why couldn't I tell my father that I'm not feeling okay? I feel sad all the time. Sometimes I feel like killing myself. Because the basic parameter was that there was no shame, that there was no fear, that I could go to a parent without those two emotions, that I knew that I would be listened to, that he will try his best, in his best ability, to help me, to find help for me. That faith in a parent was very essential. And it came to me right from the beginning in my career, in my life also. And because I think this also is probably my personality, I'm very expressive. So I write, I speak, I perform, I'm a performer. So I never had those things about, what will people think? That was never in my mind space, ever, never, ever. And I do know that there are, and you know what, stupid of me, that I thought all fathers are like that. I believe that this is what parents do. This is what all parents must be doing. All fathers must be having conversations about periods and depression and safe sex and everything else. But it was much later that it dawned upon me that no, that's not the case. And not fathers was like from another planet, but not even mothers in India had those conversations with their daughters. And in schools again, especially in small towns, there were no counselors. No teachers were having those conversations with students ever. In board classes, I now can see a lot of my friends who were going through a lot of anxiety. They used to come and tell, I couldn't sleep the entire night. Or I feel scared if I get 2% less or 1% less, my father will do this to me. So I knew that they were going through anxiety. Or then when some of them could not get into, the course they wanted to, or whatever, or the college they wanted to, I know that they were still going through a lot of depression and anxiety, but there was no recourse for it. So the stigma, as Smriti said, a lot of times it is stemming from the lack of awareness. But a lot of times, in spite of awareness, a lot of educated and aware parents who know that there is depression, who know that young children, especially in that age group, can be vulnerable to self-harm or suicidal ideation, they will never even start those conversations. And then again, the thing, okay, we can take you to a gynecologist, maybe, if you're a young woman. We can take you to another kind of doctor, but we cannot take you to pagalon ka doctor. That is just not done. Who will marry you? Who will give you a job? We will get labeled pagalon ka khandan. So that is absolute no-no. So even people who have the privilege of education and money do not, break that barrier. So how do we expect them, those who probably do not have access to that literacy, access to those services, how can we expect them to break through? So for me, it was never, I was never told to hold anything back. Likho, bolo, batao, karo, street pe theater karo, koi barrier nahi hai. And thank God, my father raised me up like that. So I feel that this voice that I have is what I had, and if I could use it for mental health, all the better for me and for everybody around me. Though I know I did find that stigma all around. My ex-husband, my colleagues, a lot of time in workplaces, my own mother. I live with two more conditions. I have osteoid osteoma and I have fibromyalgia. Now both those things are also invisible. My pain is invisible. My brain fog is invisible. I am having a bad flare that will not be visible anywhere. And I am still told, you just put an ointment in there. This is just normal backache. It happens to all women. So, that kind of invalidation constantly keeps on happening. But yeah, I think the breakthrough is that off late, I have a 12 years old here, and they have these annual projects in their school, and she and her group of 5 other students chose mental health this time. So they did a mental health project in school for mental health awareness. And I could see that, you can say indirect support that she was showing towards me, my challenges, and my work through that. So I took that as a huge compliment from me. So thank you. Yeah.
Thank you. I think that's very interesting, and I think the kind of attitude about it that I'm happy to open up. I don't care about others, and in terms of I want to I want to talk about it, and I want to seek help, and all the kind of supportive nature of the family. In some ways, is very important, really, and I think, and then how we have actually managed to help others, your friendship circles, and everybody else in trying to facilitate that process is very interesting and enlightening. Thank you for that. So, Smriti, would you wish to comment on that?
Yeah. First of all, congratulations, Pooja. I think you're raising your child in a similar way, the way your dad raised you. It just shows that you're having those conversations at home. And kudos to your 12-year-old as well. So I have something very interesting to share here. For my MPhil, my research project was exploring the subjective experiences of young adolescents of their own pain, distress related to mental health concerns. So I did a child behavior checklist self-report with children, with teachers, and with parents, just to see if everyone was in sync or were the discrepancies in those forms. And then I also interviewed these children, and it was shocking to see that for children who were saying that they had suicidal thoughts and they were already self-harming, the parents and the teacher had no clue about that, absolutely no clue. In fact, because the protocol said that if I would notice these signs, I would speak to these parents and I would talk to the teachers as well and create that awareness and help them signpost, because I was in a bath at that point in time. We could offer that support and help. We had a child and adolescent department running pretty well in the past at that point in time. And before I did this, the checklist, I administered the checklist. We had a awareness creating program for the parents, and there were a lot of parents who came up and asked, so will our child get some sort of a label? Will our child be, will they get a diagnosis? So again, coming down to the level and saying that this is a way to help. We may be able to identify children who are not yet in the diagnosable category, but it could be a preventive step where we notice they are distressed and we could do something to help them. And a lot of them had questions, but why distress? They're getting the food, they want to eat, they can order pizzas and have Maggie and whatever. They're in a good school, in a convent school, which is the best we can afford for them. They are going to school, they have the facility to go to school. They should be grateful that they have all this in their life. Where is the distress and pain, and why would they even have this? You will be proven wrong. The results won't bring up anything for you. And the teachers, their attitude was, will we be blamed? Are we doing something wrong in school? We are doing everything possible. All our children are scoring very well, irrespective where we did find that there were children with children who were slow learners or children who had learning difficulties. At that point in time, that first conversation elicits so much anxiety and so much denial about the existence of these things in this particular age group that was shocking. And then I actually shared the results with the parents and the teachers together. Believe me, there was a 5-minute silence in the room, because I had both the groups with me together, because I wanted to talk to all the stakeholders together. And thankfully, because all stakeholders were together, we could get some of these kids to get treated in the hospital. But it took a lot of these conversations with parents individually, in group. I helped them form the parent support group for parents who felt that this could be a stigma and how will we face the world and society. And I was like, why do you even have to tell everyone, right? You have to be with your child. But what I'm trying to share is that, and this was in 2007, 2008. And internet is there, and media is there, and films are there, and conversations are there. But still, when it comes to my family, my child, it is seen as if there's a deficit in me, or the teachers who are another primary caregivers for young adults. It's seen as if that, is it just about the academic performance? Then all the children are doing well. But mental health is not only about academic performance. There are so many other aspects to it. And yeah, so that's what I wanted to share with regards to what Pooja shared.
Yeah, thank you for bringing that conversation to children and young people. And I think it's important that you try and do that. And I think you right there the question of what the stress, why is the stress? And I think, I talked to a lot of my psychiatrist colleagues, etc. When we were children, there was no avenue for any of those things. We just grew through it. And I think all we had was actually our friends, because we couldn't even go and talk to our parents at that time. So we just have to try to talk about our friendship circles and try and get through those and overcome some of those things. For many people, that may not have been possible. So, and I think it's important to try and focus on the young person's perspective and their wishes and their troubles and their anxieties mainly. So, I think.
And I would like to share what the children said in the interviews. So some of these children who had suicidal thoughts and who already were self-harming, when I asked that, why you're in so much pain, why haven't you spoken about it to anyone? And some of them had so much compassion for their parents, that my parents already worked so hard and they are bringing in, and this school that I had approached was a school that was serving people who were just above the poverty line and those who were meeting the poverty line criteria. So a lot of children at, you know, had that compassionate feeling for their parents, but not for themselves. And where they said that we don't want to burden them further. So somebody who's between 12 to 14 has so much compassion, so much understanding. Despite their own pain, they do not want to burden their parents with their pain because they're already working so hard and struggling so hard. Some of them question, is this even a thing? Like, I thought if I'm having it, it's just me, something's wrong with me. But telling them that it's a condition and it can be, you can be helped and, you know, we can work through it together, gave them so much hope. And they were children who, and children gave their reasons. It was peer pressure, it was comparison with others. So those who were just at the poverty line were comparing themselves with those who were above the poverty line with, in terms of what stationery they were bringing to school. And these are such, these would sound like very insignificant things to maybe adults, that, you know, you're comparing what sharpener he has or what eraser he has. And is that a source of stress? But I would say for a child who's just joined nursery, just writing that A is stressful. As adults, we have gone through it and forgotten how difficult it was to write that first letter. You know?
I would like to add a point here, you know, and this is from a parent's perspective. And I would go even younger, like as you said. So my daughter was 6 when my father passed away, and she was also very close to him. And I was dealing with my own grief because he was not just a parent, he was a lot more, many things to me. And that was the first time I took her to play therapy, because I realized that this child needs help to process her grief. Because I was not able to facilitate that at that time, because I was dealing with my own grief and my own issues, my own health issues. At that time, my fibromyalgia was through the roof. And so I took this child to play therapy, and it helped her. It helped her process that grief very well. But in the family, there was a lot of opposition, and there were a lot of very nasty opinions about it. You know, and as Smriti was speaking earlier, that you know, it's a mad mother, and she's trying to put that mad label onto the child also. And in the school also, the counselor I spoke, and she goes to a very good school in Delhi who have counselors, and they have a system and protocol and everything. But when I told the counselor that, you know, this child is dealing with grief, so she could manifest that in many ways. So please be a little sensitive and please be a little observant. So she's like, no, we do an anxiety or some, you know, test with them and whatever. So only if a child has a learning disability, only then we look into it. But it's not my job to handle whose family is going through grief and whose family parents are getting divorced and whatever. So I can't handle all of that. So again, coming back to, again in circles, to the healers and the doctors and the practitioners. I did a story about doctors for Financial Express, mental health of doctors in India. They are wounded healers. 30% of Indian doctors are themselves dealing with depression, and they never reach out to therapy. They have departments of psychiatry in their hospitals where they go every day, where they can get help for free. They still don't reach out. So the stigma is not only where there is no awareness. The stigma is so huge, even within the community, within the healthcare community. It is so huge. And I'm sorry to say this, and this might sound like a traitor speaking, but even within the mental healthcare community, empathy and sensitivity, especially for children, especially for peripheral issues, but issues that are very crucial, for instance, disability, for instance, grief, those issues are not touched upon at all. And that is hugely detrimental to the mental health of younger people, especially.
An important point made, I think, about that. I think it's not just, I think, understanding the mental health needs of children and young people, and adults as well, but I think in this case, children and young people. It is what is important is for young people to know what the conditions are all about. And I think it's actually so that it's not them, it's actually also understanding about how it actually happen, how it might actually happen to them, and also how to help other people. I think that is more important. And I think, a literate society and a civilized society is all about that, having that collective knowledge, and trying to then enabling them to have a conversation with other people about these things. And they might not have any of those distress or conditions. Because mental health is not mental illness. And I think you don't not just
Yeah.
intervene when you have a mental health distress or condition. You have to actually promote health and well-being. And health
Yes.
and well-being is a key part of it. And that's why we need to actually provide the knowledge and skills for young people to understand what it is. And not necessarily saying that they have that condition or anything like that, for them to understand that. It is only then that they actually become a better citizen of that country in relation to how they should be understanding themselves and how they should be a socially responsible person there. So I think that is a key point. Point well made. Thank you very much for that. Now, Pooja, I want to come to the kind of theatre and the poetry element of things, really, because I think that is very interesting. From my perspective, and also I think it is something that we don't normally talk about in this kind of webinars. So can you tell me about how the theatre and the poetry kind of context and your writing, your literary kind of, how that has actually helped you in the recovery journey that you have actually made, or that you are currently making as well, because recovery is actually a lifelong journey.
Okay. So I don't like the word recovery and I don't use it. Because, it essentially means that something is wrong with me and I'm recovering from it, which is, I don't think which is the case. I believe that I'm diverse, I'm neurodiverse, and I'm psychosocially diverse, and I can't recover from myself. It is about acceptance. It is about knowing myself and managing that self to the best of my abilities. Now, poetry helped, and I realized from a very early age, because I was writing everything down. Because I remember once I was very young, and when I used to have these thoughts, and I would have these very dull days every day, and everything is all right. School is going fine. I have a wonderful set of friends. My father loves me. I have a comfortable life, a privileged life, and yet I feel that void. So my father asked me one day, and he didn't know the terminology. He was an engineer, so he did not know anything about humanities or medicine or anything. He was a very simple person. But he asked me one day that, okay, maybe if you feel this way, we should try looking at what makes you feel better, or what makes you manage this phase better. So I said, writing. So I write. So he said, yeah, so let's, explore that how can your writing help you feel better about this? What else? So I said, stage. I was a narrator. I was into theater and other things. So he said, yeah, so you should do probably those things more. And they will and he used the word, which now gives me goosebumps when I realize the technical aspect of it. So he says, you should do those things more. Maybe they will give you resilience. He said that. So I said, okay, I'll try. And that is when I started, writing a lot more. And that is how my blogs were also born later. And then theater, of course, initially we were doing just street conventional theater. So it had nothing to directly do with mental health, but the entire thing of working with a team, of being in a peer group that supported you, that was not stigmatizing you, that was not, that understood that if I'm telling them today that, I can't do this today, they understood. They gave me that space, even though probably they also didn't understand depression or my condition with my bones, that, some days could be very painful, but they gave me that space. So having that space and that support system was very important. And then I always had Papa to go back to. And then I guess when I now, see the journey, then I went into theater of the oppressed, and I started seeing theater as more interactive. Recently, a year ago, when they were having schools, my daughter did a monologue performance about fibromyalgia in school. So, even as Smriti said, a lot of teachers did not know that disabilities can be invisible. So they are teaching biology and all kinds of things in schools up to 12th grade, and some of them have PhDs, but they still do not know that disabilities can be invisible. And it took a 10-year-old to do a monologue to tell them that. So those kind of things. And also, I guess, as you rightly said, it cannot be, everything cannot be clinicalized. And as Smriti said, that a lot of things around mental health or emotional wellness need not be a disorder or need not have a label. They can just be a phase. They can just be a psychosocial issue. So the social part of it cannot be ignored. For instance, this project that my girl and the other girls did, their focus was on being listeners, being good listener, being a good peer group where they're just listening to each other. They are not invalidating the other person's experience. And that experience can be diverse again, can be coming from maybe their queer identity, maybe from their social status or their economic status. But this could be affecting their emotional wellness. So just listening, just holding space. Even if we are able to teach that much to people around, it will make a huge difference in the overall emotional wellness, I believe. So hence this entire thing of, theater and writing it down and developing these skills through theater or through writing poetry or through having conversations like these is so important, because mental health has to be performative. It cannot be in conferences and in academia and in research journals. Mental health is performative for me. So I perform it. And that is the only way I have learned to enjoy it.
Thank you very much. I think that is to the point, and I'm sure many people would take note of that. And I think it is a very wonderful way of actually putting it. And I think mental health, I think that the whole idea of actually the professor prestigious and the journals around the world in terms of mental health, but what about the common man? What about the common people? What about the, and I think it's important that unless and until we impart that knowledge and skills to the common people, then obviously a nation will not be mentally healthy. And also I think it's important that we have that conversation, and how theater and how creative arts, including poetry and literature, play a major role in it. Maybe we should actually have a whole few webinars on poetry and literature and mental health. We had that last year, and we might actually have that again as part of the World Mental Health Day in October. So anyway, thank you for that. That's very a beautiful way of actually putting it. Smithi, would you wish to comment on that in terms of the theatre mode and creative arts and how it helps the recovery journey?
What we offer, the modality that I decided Wysa would offer for offering therapy is writing. It's text. And the power of text is just simply underestimated. I also used to write diaries. I write poems. I've never shared it with anyone because sometimes I feel they're too dark for my own self. I'm usually very outspoken and supportive and expressive, but for my own dark days and moods, I resort to writing, and I find a lot of relief once I'm able to do that. And what I'm also observing in my work via text with my clients, and a lot of my fellow therapists who have joined agree to that we're able to form such wonderful bonds via writing. It's unimaginable. A lot of people question the efficacy of our work via text, that it's not audio video, you're not seeing the person, you're not hearing the person, you're missing out on so many cues, but the amount of cues that somebody's writing brings up to you, because that is sharing their thoughts directly. So we do both expressive writing and focused writing activities with them, and the kind of cues, the kind of direct observations about what they're thinking, what they're feeling, what they're experiencing, and when we write back to them and respond back to them and reflect with them on their writings, the kind of alliance we have formed is just uncomparable to anything. So as a therapist who I have practiced in-person settings as well, I have clients who are still connected with me, but the nature of alliance that I've formed with my therapist, with my clients via writing, is just simply uncomparable. a therapist and a client who has not seen each other at all. But if I say, like Pooja was saying, if as a therapist, when I shared with them that I have lost my dad and I needed a break, I needed to devote some time to my family and myself, all of them, most of them, and they are based globally, not just one particular culture, was super supportive and said, this is your time, you need to go, we'll wait for you to come back. And all of them actually waited for us to come back. So what I want to say is that, and like Pooja said, I'm 100% with you on this, that mental health is not, and discussion and therapeutic approaches are not just limited to academia. And maybe that's one reason I've never been able to draft a PhD proposal, despite the fact that many ideas and many things come to me. But I always want to do something which is very action oriented, where I'm doing something, where I'm working with people as I work on something. It cannot be done in isolation with me and my supervisor. And I share some numbers, and then what do I do with those numbers? I don't want to work with numbers. I'm not a numbers person at all. And so I've actually benefited in my own personal life because of poetry. My daughter she writes stories in poetry. She has picked up gender activism at 13. So she talks about, she reads a lot of books. She's a voracious reader. And she felt that when she would talk about gender activism, just simply sharing her own thoughts, as communicating with people, they were not so well accepted, but she started writing poetry around it. And that is being appreciated a lot at her school by the teachers who are slightly open towards receiving this kind of information. And at the same time, I have been told by certain teachers at school, including the management, that please keep your child away from sharing these things publicly, because other children may get spoiled. And this is again a very well reputed school in the Delhi NCR region. And so again, I mean, at this level, they should be talking about it themselves. They should be initiating these conversations themselves, which is totally missing.
Yeah. And writing, I know, is very therapeutic. I also do it with a lot of my clients. But again, literacy is a privilege in India. And when I say like being literate and being able to write, so theater helped me there. Because for instance, I'll give one example where I was working with somebody who were not lettered and they could not write it. So I asked them, show it to me. Where do you feel the pain? You have to show it to me. And she said, in my chest. And I said, what is the feeling? So she said, as if somebody's punching me from inside.
Yeah.
So she could actually show it to me. This is the pain. So that is where I think theater has an advantage. And also when we work with people with disabilities, especially, and children who have either learning disabilities or even intellectual disabilities at times, and sometimes some physical disabilities, where writing down or understanding a poem would not be possible, but their body becomes their canvas. That's the beauty of theater. And that is where I think theater becomes such a strong tool for mental health and therapy and counseling and everything
absolutely else. Absolutely. The body and the mind are inseparable. And I mean, the relevance of somatic work for grief, trauma is so well documented. And I think theater is a very good medium for people to actually experience different phases. And I think it can also help them become more empathetic towards other people's pain, So that's something that I really appreciate about theater and expressive arts always.
Yeah, thank you. I think that the context of theater and how interactive theater and how that actually helps people to actually try and pinpoint, what causes pain, how it causes pain, and how they actually convey that message to other people is a powerful, very powerful way of actually doing it, of self-learning, and also help to learn, help others to learn about those contexts as well.
There's a small poem that if I wanted to share, if it's okay. It just came to me, when Pooja talked about the recovery and the medical models and how binding they are. And I completely agree, because there's so many things which cannot be just treated in 12 weeks of CBT or 15 weeks of mindfulness. And, so it's a very, very, very short poem. And I wrote it in my MPhil days when I first got exposed to the clinical population. The title is She's Lost It, They Say. It's such a lovely feeling. I have him calling my name all day. I'm not lonely anymore. She's lost it, they say. But I'm happy to my core. Oh, can't you see the bliss on my face? I no longer hate it, the space we share. I'm not even here. I have my own secret place. I'm so busy in my world, not a minute to spare. She's lost it, they say. They wouldn't if they would really care. No pain, no memories. Each day is a new day. Oh, see, you can't do it the way I live my life. I've lost it, they say. They can't see me happy, pushing pills down my throat. ECTs to make me feel deprived. It's all going away, him, his voice. It's all coming back, the loneliness and this worldly noise. So you really couldn't see it and called me mad? Or was it an issue to see me so glad? That is what you call being sane, taking away my happiness, the moments of bliss, institutionalize me, pain, and only more pain. Is that even humane?
Thank you. Thank you for that. Wonderful. Thank you. Thank you for, I think this is the first time that somebody has actually shared a poem, and I think as part of the webinar. So there's always a first. Thank you. Thank you, Smriti, for that. I think that's very kind of you, and that's good. Any questions in relation that we are waiting for some audience questions in relation? There's a comment here with Pooja, and I think that I just wish to thank Pooja for putting this across. That was the previous conversations around children, and there is not a self-stigma, but stigma within the mental health community. My lived experiences never made sense to people in position within the community, and gratitude to this session. Thank you very much indeed. And I think it is that actually what makes us, having this conversation, and I think having that purpose and making meaning of those things. These conversations actually make meaning for us, also make meaning for other people. And that is part of our recovery journey. Unless and until we open our thoughts and our feelings and our anxieties and our worries and our sadness, I think it's important to do that, because I think by doing that the same way as we actually earlier discussed about how we should write about those things, or keep a diary about those things, or engage in other kind of stuff in terms of theater or other activities, it actually helps us to make meaning by ourselves as to why that is actually happening to us, and what might be the possible triggers that might be happening within the background, and also to try and understand how it might actually happen in other people. So I think it is very, very important that we do that. And I think it is important that the professional community within mental health, the professional community within mental health, as Pooja rightly said earlier on, in terms of how there should be a way of how how psychiatrists and psychologists are very vulnerable people. And I think how it is important that they also talk about how it is not an easy job to sit for a whole day and listen to people's problems. And I have there are a lot of people who resort to alcoholism because of it, because of the fact that there is no other way of actually, coming to terms with some of those things. So, but I think it's important to have those stories by professionals themselves as to how they have actually managed on a day in and day out. How do they manage that? How do they separate that detachment from work and also linking with the family, etc. So I think it's very crucial that the stories from mental health professionals themselves. And I think so, Smriti, and I think some of those poems actually cover some of those ideas from your student days, from early work days as well. Thank you for that. So Parvati tells me that there are no questions so far as yet. So we'll
I think there's one person, Nanika Ashwath, who's raised a hand. I wonder if they have a question.
Okay.
Sorry?
There is this person in the attendees list. I can't see them anymore.
Okay.
Somebody had, I think they've left.
The comment that somebody mentioned, was it? Oh, there's a question. Yeah, okay. There's a comment again. This is one of the most recent resonating sessions I've attended since the pandemic. Thank you for a wonderful pebbles and breadcrumbs, eliminating the need for cultural vocalities, interesting language, and challenging our own barriers to put things out on public platforms and resonating. Thank you very much indeed. And I think that's a very apt comment, and you use the right words there to communicate your message and your thoughts.
Thank you so much. Yeah, thank you so
Yeah.
much for those comments. And also, I would like to add, we never expect that this from other practitioners. A cardiologist can have a heart issue, have a heart issue. An orthopedist can break his leg, but a counselor or a therapist, how can you have stress? Were you not trained to handle this? How can you have anxiety? And if you have anxiety, then how will you cure the other person? How will you help the other person? So it becomes like a vicious
It's a double-edged sword, actually.
Yeah.
So a lot of well-meaning, if you give a well-meaning advice to a loved one, I'm often told, keep your psychology away. It's not what you're thinking. I'm not mad. And when there's actually a concern a loved one is facing, I'm often approached, and if I say I cannot offer assistance to a family member because there are boundary concerns, I can offer support but not therapy, and they're like, what kind of a psychologist are you? You're not understanding my problem. And then if my child has something, what kind of a psychologist are you? You can't even teach your child. I mean, it's
precisely. Yeah. So these are all such enmeshments are happening constantly for us. So it is happening on various levels of your identities and your roles, and the various roles you play. For instance, I think Chetty is in media, and I write a lot of things in media. So in media also, I mean, people are so aware, and they do so much about mental health, but when it comes to seeking help for themselves, it will be like, from your poem, they say I'm losing it. So am I losing it? And then one person a few days ago told me, if I am in a managerial role, I'm supposed to be aggressive. If I lose the aggression, if I lose the anger, then I'm not the boss.
Yeah.
So I was like, no. Let's begin from the beginning. It needs to be correct. So yeah, I mean, we have these cliches for everybody, for every role or every profession, or even your relationship roles, like if you're a parent or if you're a caregiver to a parent.
The role becomes the person.
The role becomes the person. And and then there's no space to say no also. That also happens a lot to a lot of people. I mean, I say no very generously. If I don't want to do something, and if I need that time for self-care, I will say no. And I will say it in a way that, okay, there can be other people who can support you, or I'll find you somebody, but I'm not available. But I do find that in Indian mothers especially, they never learn to say no, which is a problem, which should be a full course, which should be a life skill that they should have. I can say no. My child knows that if mommy needs her space, if she is not available for this period of time, she's not available. And that needs to be inculcated in families, between couples, in workplaces. That is one thing that we do not learn at all. So that is also needed. And these small changes, if I believe, small cultural changes, if we start making in how we lead our lives here in India, will go a long way in making everybody emotionally better, stronger, and aware of what triggers them or what affects them more and how it affects them and what can they do about it. So that is required.
Exactly, point well made. I think it is important, and I think that's part of that. Having conversations such as this, and also try helping others, especially have those conversations, is very important. There is one question or a comment. There is a question, I think, here from Nanika. I think is the name. I hope I've said it correctly. Thanks a lot for the session. Just want to ask you, how do you properly tell the child about their issues without hurting their small, innocent minds? Can I come to you, Pooja, first, and quickly, and also to Smriti?
Okay, so I'll take this as a parent, and I'll let Smithi take the professional part of it. So I will not take the professional part here. So not as a practitioner, but as a parent, listen to your child. That is very, very important. Listen to your child. And also practice self-care. practice your own mental wellness, whatever you need to be well yourself, because children learn a lot from observation. Now, my child knows that because of my conditions, I need a nap every day, no matter what. I need that nap. And she understands that. So, what is her self care? She has her own self care thing. And she knows that this is crucial and this needs to be done. So, you need to first practice as a parent to preach something. Second is listen to your child. Listen. If it is anger, where it is coming from. If it is, changes in their sleep or what they're eating or how they are behaving with their friends, or if they become too reclusive, or they become suddenly they're interacting with a lot of people, if there's those huge changes in behavior, I think a parent is that first line of defense. You would immediately know that something is off. The child is not behaving their usual self, or very different from what their personality is. And also, Indian parents especially, keep your minds open, please. Children, they watch a lot of things, they hear a lot of things. So if a child comes to you and says, "Mommy, what is a condom?" Don't just shut them up. Don't just stop them. What is this sanitary napkin? Who uses them? As I said from my own experience, once you start shutting the children down or shaming the child for one thing, how do you expect that one fine day the child will tell you and come and tell you that I am having thoughts about self-harm or I am anxious all the time? If you shame them about everyday things, about getting 2 marks less than their friend. So the shaming and fear has to be curtailed within families. Your child should be able to ask you anything. And trust you me, I've been asked things that I know nothing about, and I've been very ashamed about it कि मेरे को ये नहीं आता, and I had to tell her, "Darling, I'll find it out. I'll look up somebody who can tell me, or I'll take you to somebody, I'll connect you with somebody who can tell you." But every question is valid. No question is like, "No, you can't say this. This is a bad word. Don't say it." Even if it is a bad word or it is not an appropriate word, I will have a conversation. For instance, masturbation. I had that conversation with her when she was 6. So it is possible. It is very much doable in a very informative, nice, fun, happy, healthy, supportive, fearless, shameless way. That is what parents need to do.
Thank you, Pooja. Smriti, a quick comment?
Yeah, I think it'll be a quick comment because Pooja covered a lot of what professionals would guide the parents to do. I would say, first of all, I think the question said something like how it could not ruin their innocent mind. So I think that is something that reflects that one may be seeing their concerns as something that could, that are not something which humans could have, something that one should be ashamed of, because unless we think that they can, that has the capacity to ruin innocent minds, because this is exactly what I heard from the school principal for my daughter's poetry, that she should not share it publicly because it will ruin innocent minds. It shows one's own shame or maybe one's own stigma about these concerns, that these are something to be not talked about, and how do we bring it up in the most hushed manner that they will not impact the young minds. But I would say young minds are very receptive, very absorbent, very moldable. And I think like Pooja shared her own experiences with her father, that, if you have that conversation in a matter of fact way and tell them, people go through this and it happens, and it is not something to be scared of, and we can deal with it together. And if we need to see a doctor, we'll see a doctor. Just like you have a tummy ache, you have a fever, we can feel sad. Sometimes sadness can extend more than a day or two, or it can be very disturbing. What is happening to me? But I am here for you. Come and talk to me. Believe your child. Believe your child. That's so important. I have been a sexual abuse survivor, and I think something that didn't happen with me when I was young was nobody believed me. And it came out as a full thesis for my master's, where I attempted to study the personality of a pedophile, simply to understand my own experiences. But at the same time, and that is the time I wrote about it in the preface and the first thing. And that's when my parents and I, what is this? And I was like, why? I have come out with, I have been that child maybe where a lot of conversations did not happen, and I was a rebel in many ways. And so I think that probably happened because there were conversations, but there were some conversations which were hushed and buried. So trust your child. If they're coming and telling you something, I'm sad, I'm distressed, say, okay, that happens. Tell me more about it. What are you going through? And I think rest of what Pooja shared was amazing.
Thank you very much for that. We've been actually having this conversation nearly for the last hour and a half. So I think it's an important thing just for the last 4 minutes. So I want to kind of bring it all together in a closure statement. First of all, my sincere thanks, many thanks, Pooja and Smriti, for coming on. And I think we spoke about not just the mental health angle, we spoke about a number of wellness angle. We went into children and young people, which wasn't part of the agenda. So I think there are a lot of gems being dropped here in terms of knowledge base and a lot of practices and a lot of experiences. So I think there is a lot to be learned. And obviously, this particular session would be is recorded and obviously will be available on YouTube and Facebook. And other social media channels for people who might be able to comment and understand about this later on as well. But I think the sheer breadth of the discussion in terms of the experiences, the way theatre and poetry and literature has actually helped, and how poems might have actually helped to come to terms with some of those things, and how the whole idea of how mental health professionals also need to be coming up front in terms of seeking how they actually try and resolve some of the issues within themselves, and also about young people and how we provide advice to young people, how we care for young people, and how we help them to understand what the condition is. It is not about them having a distress or a condition, but it is actually enabling them to understand that, how we make this actually a public mental health initiative. And I think that is the key issue. Public health is not about sanitation and water and everything else. That is important, but it is more about how we actually make this a common conversation in our everyday life. So I'm very grateful to you both for initiating many ideas, and I'm sure we will be having many more conversations surrounding this. So thank you for inviting. Thank you for accepting my invitation. And bringing a lot of points into our webinar. So do follow us on our Facebook and also on our YouTube and also on Twitter from the MeHeLP India project perspective. And also, do communicate. We are actually available on the web. Do communicate with us, and I'm sure together we can change the conversations around mental health. So have a good afternoon, have a good evening, and thank you, Pooja, once again, and thank you, Smriti, and we will be in touch soon, and have a good evening.
Thank you.
Have a good day, sir.
Yeah.
Bye-bye.
Bye-bye.
Bye.